Now, how you should wear a badge? Wearing a badge on the collar region, because the collar region include head, neck, lens of the eye are important. A thyroid is supposed to be protected when you are dealing with a long exposures like fluoroscopy. A thyroid guard is essential. Now, what is a wearing period? Each member of the staff wear film badge for a period of 4 weeks. Now, here we have said 4 weeks. Ideally, it should be 4 weeks, but by and large, it was going to be of 3 months in most of the institute. But ideally, it should be 4 weeks if it is film badge. Let's warn you again, if it is film badge, which is not used nowadays. What we are using nowadays, we are coming to it shortly. At least at the end of period, the film inside is changed. The exposed film is sent to the BARC lab. Now, what is the disadvantage? They are not sensitive enough to capture low radiation or low level energies. They were not catching, because you need at least a radiation which fog the film at that distance. So sensitivity of it was a bit a problem. It was not sensitive to low radiation. Then there is susceptibility for fogging was reduced, or you can use or you can store the film batches in a place which is not humid, which is not having very high temperature, which is not having a bright light, because that will cause a fogging to the film, and they should not be used for more than 4 weeks at a stage. Then what was another disadvantage other than these? Like working conditions are not in your hand, then storage space is not in your hand, so whatever was available you have to make use. That's why this was called as a disadvantage, and we went to some other radiation monitoring. Now, it is enormous task to chemically process a large number of films. It's the headache of a laboratory, and subsequently compare each of them to the test film. What is important here? This thing cannot be standardized properly, or this thing cannot be properly sensitive. So we went to some other device that is called as TLD in routine term, that is thermoluminescent dosimetry. Now, what is it? The limitation of film batch are overcome by the TLD batches. As I told you, whenever you are finding disadvantages, you go towards a new technology which gives you a better solution. Now, thermoluminescence is the property of certain material to emit when they are stimulated by heat. Now, materials such as lithium fluoride, the lithium borate, calcium fluoride and calcium sulfate has got this property. That is, when they are heated, they can emit light, or when they are exposed to radiation, they can store it in them. So when lithium fluoride crystal is exposed to radiation, a few electrons become trapped in the higher energy shell. These electrons, when they return to their normal energy level, the lithium fluoride requires heating. So when you heat, they will liberate this energy out. As the electron return to their stable state, light is emitted because of the energy, which is difference of two orbital levels. Now, the amount of light emitted is measured, and it is proportional to the radiation dose. So we know how much radiation dose patient has received, the doctor has received, how much dose the radiation worker has received. All these things